The World Health Organization identified antimicrobial resistance as one of the top 10 global health threats. By 2050, they think up to 10 million deaths globally could be attributed to AMR. BSI see this as being a key issue, so we've created a kite mark called Minimised Risk of Antimicrobial Resistance. During the assessment programme, we audit the manufacturing process that the pharmaceutical company goes through when producing either the API or the finished drug product. We're looking at the risks of antibiotic residue getting into waterways or getting into solid waste during things like the cleaning process. The risk, if they do get into those waterways, is that bacteria that is in the water ingests that antibiotic residue and then becomes resistant to being treated with that particular antibiotic in the future when we're giving it as patients. The pharmaceutical industry, in some spaces, has been complying with the antibiotic manufacturing standard for some time, but what they haven't had is that independent oversight that third-party certification brings. The NHS recognise that AMR is a critical challenge, not only for patients, but also for those communities where the antibiotic itself is being manufactured. Through their NHS initiative, in July 23, they introduced new requirements. If you're looking to provide innovative antibiotics into the NHS, you are going to need to become certified to the Kite Mark certification programme. Firstly, download the standard and then call BSI and we'll have a conversation with you to guide you through that assessment process and help you meet those tender requirements. This Kite Mark is critically important. We want to know that when our loved ones are in hospital with an infection, that they're going to be able to have antibiotics that appropriately deal with that infection. We cannot continue to create antibiotics that are impacting communities that are becoming resistant to those particular antibiotic drugs.